All right, so we're calling this Our Journey Continues because I was able to speak for IDD about a year and a half ago, as well at another action committee meeting, and then was able to present here as we've moved forward and kind of continued, and we've made a lot of progress since then. So thanks for being here. Let's get our fast forward going, hold on. There we go. So today, the things that we're going to talk about, and we want to have a whole lot of time for discussion because that's one thing I've been able to talk about this a bit, but haven't been able to answer a lot of questions. So we're going to talk about the pilot nursing course, which most of you have heard about, so that's going to be pretty brief. Then the interprofessional healthcare course, which is kind of our next step, since we've piloted that nursing course for several semesters already. Talking about the modules, which is really what most of the questions that I usually get is, what are you putting in this course? How are you making it a full 3-credit workload? And so I'm going to show you. Please don't, like get started on it. We're still trying to publish. We're still working on it, but I just don't have enough data because I didn't collect it well. All right. So, and then we'll also talk about just the different ways that I created the course in thinking of universal design and trying to reach as many learners as we could. And we'll talk about that as well. And then, of course, the standardized patient program in which we have interprofessional simulations bringing in our health messengers. And then what we're doing next. All right, so first, the pilot nursing course it is exploring disability in healthcare. It's an undergraduate course for BSN students only. It's 3 credits. It's a 16-week semester, and right now we have it capped at 25 students, which is standard for our elective courses. We started in fall 23 was the pilot when we first got it ready after that, all of that collection and all of the help from so many people in this call. And now we've piloted it. We're in our 4th semester. It starts Monday. Our 4th semester will start. We've had nothing but great evaluations. Everything has been fantastic. We just have a whole lot of exit data and not very much entry data due to some collection issues. So we're working on that, and we're also working on surveys and finding the best surveys that we can use for these courses. And I hope to talk about that a lot more at the end because that's really the biggest help I need. All right, moving on. So now this is the interprofessional course, and that's the step we're on, and we'll talk about the course in detail. This course is going to be a graduate level course so that all of our schools can take it. We have it in undergraduate nursing, but this will be our dentistry, medicine, nursing, pharmacy, and social work graduate students, graduate level students. It'll be a 3-credit elective, another 16-week semester, and I believe a 26 student enrollment. The problem that we're having with this course right now is just a lot of logistics. It's been submitted, right? And everyone's shaking their head. They know, as we know in this work, well, at least I've been very lucky at University of Maryland. Everyone is so supportive of this work, and great, Rebecca, get it done. Great, we're here. But everything is a learning process for me, and I'm just learning. So it's been a process learning how to submit a new course to our graduate school. We've had turnover, funding issues, who pays for that? Because I don't teach at the graduate school. I teach undergraduate with a full workload. So there's a lot of logistics, but I'm not stopping. My plan is that this course will be in effect in the fall. And we'll talk more about it, what's in the course here. So and I do want to add, I'm going to call that nursing course a pilot. I'm going to continue to call it a pilot course until we get it as a primary course. This is a pilot as an elective is how I've kind of ventured it in my head or figured it in my head, is that when people ask me, I say, oh, we're piloting it. And they say, well, how long are you going to pilot it? And I say, until it gets approved as a full course, as a required part of our curriculum. And I think that we need to be putting that into everyone's heads, that this is just as important as our palliative care classes and I can name every kind of extra class that we've added in the last 5 years, and this is just as important. All right, so here's a look at the actual course. I know I teach undergrad, so I love to give some visuals. I hope it's not too large, but this is our Blackboard screen, modified a bit, of course, of what the course entails. But the focus of it are these 6 course modules that are created on SoftChalk, which is just a module management system, learning management system. And this is the backbone of the course. These modules and a discussion board and an external module make up a 2-week block of time. It's that simple. This is an elective course for adult learners, and we try to use, again, we'll talk more about universal design, but we're not micromanaging due dates. There's a lot of flexibility here. So in the 1 week, in a 2-week time, they'll have one module to do and so forth. You can see the content that we've put in here. And we followed, I believe, I don't want to stay too long on this screen, but the course modules that we are using, here's what's in them, right? And again, I won't stay on this screen for too long, but as you can see, we've taken and we use the core competencies from the ADHCE as a primary component of these. I wish I would have added that in the slide of how we link them. And we've taken those core competencies and created our modules based off of those. They're nearly lined up exactly. And from there, it was really just a matter of me going through and saying, okay, here's the core competency, but there wasn't as, that's where the meat comes in. And I just kind of went through and picked the meat. And I picked that meat based on all of the people that I've been kind of been mentored by in the last 3 years, and every meeting that I've been to, and every study that's been posted in a Zoom chat, and I've gone to them, and those now are spread throughout my course. So these new I know, Sarah, I think you just came out with a new article, and I'm like, it's not in my course yet, but I need to find a place to put it. So that's really kind of the meat of it is and what took the longest. The thing I want to draw your attention to is the module 4 here. So this is the nursing course. The module content won't change, right? Because whether you're an undergraduate student or upper grad, right, or a graduate student, you still need to know the basic content, which we don't. But that module 4 will be really where we get specific in the interprofessional, where each discipline, and we've got a great team here at University of Maryland, each discipline is going to create their own module 4. And so you can see what I have in there now for my nursing students, for my undergraduate nursing students. And there's more. This is just a general. Of course, there's little, different things and links added all throughout, but these are the main content. School of Medicine will have a whole different thing here, right? They'll have a whole different scenario, and a whole different line of content. So that'll be a major change in that interprofessional course. This, we've had people within, another thing that I really would love to do is have an entire, well, we'll get to that in the chat. All right, let's keep going. Another thing that we have in the course, as part of the course, are the Special Olympics modules, the Inclusive Health Fundamentals modules that are supported by the Golisano Foundation. This is about 3 hours of learning, and it's all hooked onto their Blackboard, right? So it's all in one place. It's about 3 hours of learning, and they're just expected to submit the certificate at the end of the course, right? Because they can do one each 2-week block. So this is another little component of the course. I don't want to say little, they're great modules. The other thing we have, because remember, this is a 3-credit course, so that's been the difficulty, is where do we find enough content to really make this enough? So the additional course content, is the Equity Access module. That's on accessibility. It's similar to the Special Olympics Inclusive Health. It's just it takes them about an hour and a half to go through it. It's really just on accessibility. So that is tied in with their accessibility 2-week block. They also have 6 discussion boards. These have changed based on student feedback from when I started the course. And so I think that's a really cool thing that's come about. These have just changed. The Disability TED Talk students brought me this and said these would be better than something else I had. The disability impact and influence is something that's come from the last several semesters of the nursing course, where students are coming to me telling me about people they follow on social media with disability. Because of the course, they saw someone, they followed him, and they wanted to share it with me. And I thought, well, here we go. Let's make this a requirement, right? The whole purpose of this work is to share it. So those 6 discussion boards, again, they're each linked with a 2-week block. So they'll have a module of mine, they'll have a Inclusive Health Special Olympics module, and they'll have a discussion board, and that's that block. There's also 2 exams that they will take, 2 50 questions exams. These are nursing students. They still take boards. So we couldn't take that out of that, and we didn't want to. These exams aren't tricky, right? These are exams that everyone, we kept them to where they included all healthcare professionals. And they're really about etiquette and communication and accessibility and all of those common sense things that we think students should know or we want our students to know. And then lastly, we have an interview essay. So these are thoughtful assignments. And the interview essay is to select someone that has a disability and interview them. And these are the components. I didn't want to bore you with too many details, but they're going to get a background in their disability history, their experience with the healthcare system, their recommendations for healthcare, right? Because these are healthcare students, and our goal is for them to see what's happening in healthcare, and we want them to hear the lived experience. And then, of course, the student reflection. One of the things we're again trying to use universal design in this learning, and one of the things we let them interview anyone. It can be a patient, it can be a family member, it can be a classmate, and this is the best part really of the course, I think, is reading these. And a lot of, you'd be surprised how many students interview family members that they've been and they say I've never been able to ask them these types of questions. And we don't even have a script, nothing. It's just general. This conversation gets to go however it goes. We make sure HIPAA's, taken. We have notices about, not disclosing any names, all of that. We also have the guided reflection, which I believe is the last main assignment. And that is where, again, giving the students multiple options to complete it. They can attend a small guided debrief session that lasts about 30 to 45 minutes. And we do it, I do it on Zoom the last week of the course, or it's an elective, so I let them finish early, I'm not gonna lie. But that last week of what I consider my course, we set those interviews up and those meetings up. I just do 3, they can sign up to anyone they want. They can also do it in written format, or they can do it in video format. So they can submit those in a multitude of ways. The guided reflection debriefings, I just wanted to kind of show you what we go over, whether it be in a Zoom meeting, right? And we usually keep it to about 5 to 8 students in those meetings. We're talking about their growth and insight and what they learned over the course, because really none of it is going to matter unless they can stop and go, wow, what all did I learn in that busy semester? Because these are all busy healthcare students. Their practical application, their changing thoughts on the disability in the healthcare system, and then of course they still get graded a little on their participation, grammar, all of that. Um, and for universal design, we're all educated in here. We understand the concepts of really just wanting to make learning as easy as we can for our students to access, and to make our learning easy to use, and to make as many people be able to use it effectively as we can, right? And that's what we need for this course, so that we're not limiting it to anyone. Everybody can use it. And hopefully our students are learning some universal design principles, because I make sure I point it out, like, hey, there's a reason we're giving you multiple reasons to do this, right? In multiple ways. So students so they put it together and say, oh, this is an accommodation, right? In a sense, but everyone is just getting it. There's no reason why everyone can't have this freedom, right? And this ability to submit things in a way that works best for them, I should say. And so then we come to the best part, right? And I know everybody's smiling. The best part of this work has been working with my friends from the Special Olympics Maryland. They pulled me in, just like all of you. They pulled me in when I said I need to learn as much as I can, and just included me in this amazing community. So what we have done is we've created this partnership, and we are now using our Special Olympics Health Messengers as UMB, University of Maryland, Baltimore standardized patients, and not even University of Maryland School of Nursing. They are part of just the UMB system. Our new standardized patients are being used by the School of Medicine, School of Social Work, and I think more coming. So what we did is we collaborated with Special Olympics Maryland. We started a recruitment and fellowship process where we met, I want to say maybe summer of 23. We all got together and met each other and established some relationships, and it was just fantastic. We did some interviews and really tried to pick our best health messengers to come on board as our standardized patients, and we did. We selected 4 of the best. And now we have even more. I want to say we're up to 8, but I'll let them talk about that in a minute. We onboarded our new employees. They are hired and are paid by the University of Maryland, Baltimore. We did a lot of planning, a lot of training. We just have a few of us here, but let me tell you, it took a village to put together this simulation for our school, and it was amazing. And so in the picture, we have Mackenzie, who's here with us today, Jimmy, Paris, Faith, Annu, who's here with us today, and Kayla in that picture. And here's a little bios about them. I would love to introduce them real quickly. Annu is an athlete leader from Baltimore City, competing year-round in Special Olympics. He's also trained as a Special Olympics Maryland Health Messenger. This training empowers Annu to advocate for the health needs of people with intellectual disability and promotes his knowledge of health and change in health behaviors. Annu wants to set a good example for other Special Olympic athletes by exercising, eating right, and taking better care of himself. And I'll let him tell you more about himself. And we're also joined by Mackenzie Irvin and Kayla Shields, the directors of the Inclusive Health and Fitness Program for Special Olympics Maryland. I'm going to share this screen with you as we end because I want to see their faces as they talk. This was our interprofessional event that Annu is going to talk to us about now. And we had just the best day. We just had the best day. And there's some references. All right, let me stop sharing. And if we can unspotlight me, and I would love to introduce Annu. Annu, are you with us? Can you hear us?
Yes, how much y'all?
Hi, Annu, how are you?
Fine, fine.
Thank you for joining us today. You and I have been together a lot lately, haven't we?
Yes, we have.
Why don't you say hi to everybody and just tell them how it's been working with the University of Maryland, Baltimore. Tell them a little bit about yourself.
And Annu, before you get ready, can you turn your camera on? I want to see your smiling face, especially with this cold weather.
Mm-hmm.
Please don't remind me of the cold weather.
I know. There. Oh, and you have your cowboy hat. You are ready to go, sir.
Yeah, I am.
Excellent. All right, Annu, tell us about yourself and tell us about being a standardized patient.
Well, being a standardized patient, it kind of okay. I'm going to say this in my own words. Being a standardized patient rocks. Just like my job as a self-advocate educator, it helped me teach the standard the students who's trying to be nurses how to deal with patients who have intellectual disability.
Yeah, absolutely. Where did we just go? Tell everybody what we just got to do.
Well, last year we went to Minneapolis for a health conference. I was one of the presenters talking about my job as a standardized patient and my role as an athlete leader and health messenger.
Yeah, we were invited by Special Olympics International to speak at the American Public Health Association about this work that we've been doing and spread this word, right? It was exciting. And it was Annu's first flight, right, Annu? That was your first flight?
Yeah, that was my first flight.
It was a great time. All right. How about Mackenzie and Kayla? Are you guys with us? Do you want to share anything before we start taking on questions? I know there's going to be so many.
Yeah, we're just really excited to be here. I'm Mackenzie. I oversee our inclusive health and fitness team here at Special Olympics Maryland. And, every day I get to wake up and work alongside Kayla and athletes like Annu to learn advocacy skills, to make sure that we're giving back to our communities and to really create communities of care. And Dr. Weston has really underscored that need as well. And so we always want to be that invisible string that is connecting communities together so that we can best serve our athletes because they have a lot to give. They have a ton of gifts and abilities, and I'm really lucky that Annu has taken this opportunity. I've seen him really grow from a personal level of going on that first flight. He was able to navigate some time, I went to bed, but Annu got to go on some night walks around Minneapolis. And have the impact on the students, I think is really what has been eye-opening to see is, a simple 2-hour simulation has really kind of transformed some students' opinions and experiences of caring for people with intellectual and developmental disabilities. Kayla, do you have anything to add?
Yeah, hi, I'm Kayla. I'm the director of Inclusive Health and Fitness at Special Needs Maryland. And this project has been such a joy to watch blossom. It started out with 4 of our health messengers, now we're up to 8. And not only has it been so nice to see our health messengers be their own health advocates within being a patient sim, but it's also been so nice to hear the feedback from the students who are participating in this lab and listening to the feedback that our athletes are giving them, but the students really taking everything in and readjusting. I should have asked this question a little bit differently, or I should have maybe worded this question not as jargony, not as lengthy, or maybe just not asking the question at all because it wasn't that relevant as they thought it was. So it's been really such a joy to hear both sides from our health messengers being the advocates, but then also listening to the students take the feedback and then move on to the next case and take everything that they learned with them.
That is wonderful. You guys see what kind of a team I'm working with here. It is truly been amazing. And I think I'll close out with the most exciting thing. Probably, I don't know, everything has been so exciting, but something that's been really exciting for me is that right now, as we speak, Kayla and I are waiting to be published with Helen about, and it'll be Kayla and I and our friend Paris Bennett, who wasn't able to be here with us today. We are about to publish a little article in Helen about the journey of him becoming a standardized patient. And Annu and Mackenzie and I wrote up a little article for Helen about Annu's journey to the APHA. And so he is about to be a published author all in just a few months, we hope, if everything goes well. So that's kind of the most exciting thing for me is to really share this, right? And to get the word out. So that is all that I had to say. I hope you guys have some questions for me. Thank you for having us.